of the numerous neurological disorders that can mildly or highly affect an individual's way of living. One of those is the cerebral palsy, which, according to the IDEA, this neurological group of disorders is under the orthopedic impairment. It has also been stated by the IDEA that an orthopedic impairment can highly affect an individual's learning. In this case, cerebral palsy contains a high possibility that when an individual possesses this disorder, it will inevitably create difficulties towards the normal functions of the brain because it is a collection of conditions that can impact a person's ability to move, balance, or even to maintain their posture. There are numerous subtopics that must be discussed, and it will be discussed in this video. Those are the symptoms and the signs, followed by the expounded details of its causes and effects, and lastly to discuss it is the diagnosis and therapy.
Signs and symptoms appear during infancy or preschool years, although it can vary greatly from person to person. Cerebral palsy can affect the whole body, or it might be limited primarily to one or two limbs or one side of the body. Generally, signs and symptoms include problems in terms of the physical aspect. Here are the following in few of the many signs that can be noticed in a person who has cerebral palsy. The first one is the movement and coordination, followed by speech and eating. Development in an individual's neurological aspect, and other problems that may provide damage to the brain. The brain disorder causing cerebral palsy doesn't change with time, so the symptoms usually don't worsen with age. However, as the child gets older, some symptoms might become more or less apparent, and muscle shortening and muscle rigidity can worsen if not treated again.
Brain injury is one of the main causes of cerebral palsy, but there are still two types of cerebral palsy, which are the severe and mild. A person with severe cerebral palsy may require special equipment to walk or may be unable to walk at all, necessitating lifelong care. A person with mild cerebral palsy, on the other hand, may walk awkwardly but not require any extra assistance. Though the exact symptoms of cerebral palsy can fluctuate during a person's lifetime, the condition does not worsen. Movement and posture are issues for all people with cerebral palsy. Many people additionally suffer intellectual disabilities, seizures, visual, hearing, or speech issues, abnormalities in the spine such as scoliosis, or joint problems such as contractures. Along with these, a person with cerebral palsy can also accumulate several complications such as contracture, malnutrition, and mental health conditions.
Third, body diagnosis and treatment. Cerebral palsy can be diagnosed through brain scans such as MRI or laboratory tests. Unfortunately, has no cure, and in most cases, it cannot be prevented, but there are still ways that can be done in order for a pregnant individual reduce its risk or percentage of their child acquiring it. There are several steps that must be examined and taken to minimize complications during pregnancy. First, one is making certain that you are fully vaccinated. Vaccinations include one that can prevent you from diseases such as rubella, although getting vaccinated is preferable to be done before pregnancy to avoid fatal brain damage.
It's important to get a prompt diagnosis for a movement disorder or delays in your child's development. See your child's doctor if you have concerns about episodes of loss of awareness of surroundings or of unusual bodily movements or muscle tone, impaired coordination, swallowing difficulties, eye muscle imbalance, or other developmental issues. Other than the preventions that we have mentioned above, it is also a must for the pregnant individual to be responsible of her own body and health in order for the unborn baby to avoid the risks of acquiring this disorder. We should not also treat this condition as a hindrance for an individual to learn, because that would be the last thing that they would need. We must be able to support them to cope with such condition by accessing services, being an advocate, and still fostering their independence and individuality.